Good evening. Welcome to the October 12th, 2021 special meeting of the Pequannock Township Council, acting as the Board of Health.
You got to move the mic.
Ms. Marsh?
In accordance with the requirements of New Jersey's Open Public Meetings Act, notice of this special meeting was filed in the office of the Township Clerk, posted on the bulletin board in the municipal building and on the Township website, and mailed to all persons requesting notice in accordance with Township policy. 48-hour notice of this meeting was also transmitted via fax or email to the Suburban Trends and Daily Record newspapers. Notice of this meeting included statements that the purpose of this meeting is to review the Pequannock Township Health Department annual report and that no formal action will be taken.
The clerk will please call the roll.
Mrs. Florence Lynch?
Here.
Mr. Hurd?
Here.
Mr. Cole?
Here.
Mr. Phelan? Oops. Mr. Dreesy? That's a
I don't know
typo.
what I'm supposed to say.
Mayor Russell?
Here.
Poor guy.
The only item on this meeting's
that's
agenda
funny.
is a presentation of the annual health report. Mr. Catanzaro.
Good evening, Mayor and Council. In your capacity as Board of Health, reports documenting the Health Department's activities for 2020 and through September 30th of 2021 have been submitted for your review. I'm happy to report that all state-mandated public health activities, as set forth in Title 8, Chapter 22, entitled Public Health Practice Standards of Performance for Local Boards of Health in New Jersey, have been completed in 2020, and the department is on track to meet its obligations in 2021. Just to give you an idea, these reports cover a lot of different things, but the main activities that are mandated by the state that we perform on an annual basis include immunization audits of all public and private schools, communicable disease reporting, surveillance and investigation, child health conference, including children's clinics and wellness checks, rabies control through licensing and rabies vaccination clinics, investigation of public health nuisance and environmental complaints, enforcement of New Jersey public health statutes and local ordinances, inspection of regulated establishments and facilities such as retail food establishments, body art studios, public recreational bathing facilities, youth camps, and tanning salons, among others. We also engage in septic system design approval, permitting, and installation inspections to assure compliance with state codes. The Pequannock Health Department has had a history of exceeding these minimum standards that are set forth in the statute. And while there's been enormous challenges presented by the pandemic, certain programs and activities had to be delayed or postponed. However, we were still ultimately successful in continuing the tradition of exceeding these minimum standards. On March 9th, 2020, the state of New Jersey declared a public health emergency due to the rapidly emerging COVID-19 pandemic. This has been the primary focus of the health department since that time. As we finish the 18th month addressing many challenges presented by the pandemic, the health department staff continues to consistently provide an effective response across the 5 municipalities within its jurisdiction with a high level of professionalism and dedication. I do want to go through some highlights of the pandemic response, and then we can see if you have any questions pertaining to the annual reports. The first activity I want to highlight is the guidance and the information and the enforcement that we were responsible to enact during the course of the pandemic. The Pequannock Health Department balanced what I believe very effectively was we had to get information to the public, we had to educate the public, we had to give guidance, and by public, I mean really the businesses, the residents, the organizations, civic, religious, first responders, community leaders, across every spectrum of the public, we were fully engaged, and it was the volume of calls that came through the office last 18 months would measure in the thousands. Our staff were engaged 7 days a week, and people were very, very upset by what was happening. The unknown is something we all fear, and this really presented the unknown. This novel strain has given us surprise after surprise over these 18 months. Situations have evolved very quickly, and the department has had to be fully engaged receiving volumes of information daily, some of which changes on a daily basis. The governor would make announcements before we would even know certain things through the proper state channels, and that made it a little difficult when we were getting phone calls 5 minutes into his press conferences asking questions about what his statements involved, and we just simply couldn't answer because we just weren't getting the information through the correct channels. But we met this challenge by engaging directly on the phone, through email, through personal meetings, with again, hundreds if not thousands of people over this course of time, and made sure they were fully aware of what they can do to protect themselves, what the mandates provided, what type of business activities they could do. We had a lot of instances where the businesses were doing far less than what they were allowed to do because they just feared doing the activity. They were in fear of violating the law. And I can tell you, on many occasions, our phone calls gave guidance to try to get them through this maze of regulation so they can at least operate as close to normal as possible. It wasn't perfect, certainly, but our goal was to try to maintain society as close to normal as possible. We also viewed public health globally, in the sense that it's not just COVID we were concerned about, but there was a lot of other mental health issues that were resulting from this. We had opioid addiction issues that were emerging, suicide issues emerging, depression, and a lot of other feelings of isolation. The nursing homes, I mean, a lot of people in nursing homes were virtually imprisoned for 4 or 5 months with no relief in sight. And so these families would call us and would ask us for guidance and see how we might be able to intervene to help these folks. And it was heartbreaking, and it really was a difficult time for everybody. My staff has family in nursing homes. They have family who've had businesses affected. We've all been affected by this from top to bottom. It's been a tragedy. And but by giving the guidance and the information and enforcing with responsibility in a way that wasn't heavy-handed but really educational more than enforcement, we seem to get through it fairly well in this community. And I'm actually proud of not only the staff but the people in town here really held up very well through this, I think. There's a lot of difficult times that we faced, and we're not through the woods yet, but we're going to continue giving that guidance and information to really guide everybody through it. The second thing I want to discuss is the disease investigation and contact tracing. Our staff was inundated with investigations. Across this time span, we investigated over 4,000 positive COVID cases in the 5 towns. 1,659 of those cases were here in Pequannock. And all the towns in New Jersey were overwhelmed by the volume of work that had to be addressed. And so they did stand up a private contractor who was to alleviate some of this workload. And it was successful to some extent, but it was also, it was really like being a crash test dummies on this new system that they had put in place. It wasn't dovetailing right with the system we had, the communicable disease system with the state, and so it was a real challenge, and in some ways it made it more cumbersome than helpful, but ultimately this workforce did help us. And again, we were able to investigate over 4,000 cases over the last 18 months. Most of the 18 months, it was a 7-day endeavor for the nursing staff to address these things, and they did a fantastic job. The tracing, I would say, we've all read a lot of things about the contact tracing and whether it was effective or not. It had a purpose. I think it was effective on a certain level, but it wasn't entirely effective, maybe not as effective as it was touted to be. People were uncomfortable cooperating a lot of times, giving us information. And also, there were glitches in the reporting system where labs were not putting the correct information in the system, giving us skewed data, and that had to be worked out over a period of months. Eventually, that did find its way, and I think the information was relatively reliable from a trend standpoint. But exact numbers, even now, they do fluctuate at times because they have to clean this data on an ongoing basis. And then the other part of this, and there's so many parts to this pandemic, I could talk until dawn. And Adam knows I'm fully capable of doing that. So we're going to abbreviate this by just hitting these a couple of points. But the last one I want to discuss is the vaccination effort. It became apparent in December, late December, that there was going to be a massive vaccine shortage. So I had initiated a proposal to a couple of private sector businesses that I thought, or organizations that I thought would be very helpful to my operation here. So I had approached Atlantic Health, anticipating that this could be a problem as far as the health department actually getting the vaccine. We also had to keep the vaccine at these ridiculous temperatures, 80, 90 below zero. We just don't have the capacity for that. Even the equipment there was a shortage of purchasing freezers. It was cost prohibitive. It didn't make a lot of sense to purchase these items at the cost they were asking, and delivery was uncertain. The dry ice option was unsafe, and it just wasn't a practical way to go to get this vaccine. But lastly, and most importantly, there was no vaccine for us. The local health departments, almost none of the departments were able to receive any number of vaccines. Only a few county departments and a couple of locals did get it eventually. But we, no matter what we ordered and no matter what paperwork we submitted, it just wasn't in the cards. And so I was really excited to work closely with Stephanie Schwartz, president of Chilton. She was fantastic. She was never too busy to take my calls. She was willing to hear my proposals and what my suggestions were, and she gave me every resource necessary to put a program together to get appointments for those who just couldn't get appointments. In addition to the shortage, what happened was they kept progressively, the state, progressively made millions of people eligible with no adequate supply. And this caused a panic. It caused a high level of anxiety, anger. We were getting bombarded with phone calls. People had to compete to get appointments through the computer or through their cell phones, through electronic means. The most vulnerable in our society are not adept at using these technologies. And so they couldn't compete to get appointments. And so in January, we had a serious problem. And these folks were at risk. They were frightened for over a year. They were locked in their homes for over a year with nowhere to turn. So Atlantic Health did help us through non-technology means to actually help us. We formulated lists and had literally thousands of doses directed to these vulnerable populations through the telephone. They received phone calls. They didn't have to go anywhere. They just got their phone call, and we facilitated that with Atlantic Health. And she did a fantastic service to this community, and I'm grateful to her for that. She really did a great thing. It enabled us to do our jobs at a high level, which in a crisis, the tide was against us, to say the least. The other part of the vaccination effort is I had our nurses deployed to the mega site down in Rockaway at the Sears building. And so they put shifts in from April all the way until it closed in July. And hundreds of thousands of doses were administered through there. That site helped Morris County become the best rate of vaccination in the state. And since New Jersey is one of the best vaccination rates in the nation, that's one hell of a statement that we were the top in New Jersey. And I think that mega site went a long way to doing that. So we were happy to participate. I don't know if anybody went down to look at it, but it was really an incredible operation to see. It was very impressive, and we were happy to be a part of it. And the nurses put a lot of work in at that time to help that effort. And the last partnership that was vitally important to us was I had noticed in December, actually, that Walmart was not included in the federal program to get the nursing homes vaccinated. It was Walgreens and CVS. So Walmart, for whatever reason, was not approached. And they have a huge health and wellness division nationally. And so since we have one in our jurisdiction here in Riverdale, I started there, and surprisingly, through just a tiny bit of persistence, I got my way up into the corporate ladder pretty high in the health and wellness division, and they were very excited that I approached them. Nobody else had approached them about doing some kind of a cooperative operation to get vaccine targeted to their own communities. And so they didn't have any vaccine yet because they hadn't been accepted into a federal program. But I called weekly, and then by late January, they said, Tom, guess what? We're getting vaccine. Where do you want to have clinics? Their problem was they were getting more vaccine than their retail outlet space would have them administer. And they only had a certain amount of floor space that was dedicated for this purpose. So my feeling when I approached them, what I proposed was to find big box locations that we would help staff. They would bring the pharmacy, the pharmaceuticals, they would do the paperwork, they would put in the paperwork with the federal government, whatever had to be processed, and we would help them with staffing and get the cones and the tables and the facility, and they were really thrilled with it. We had several pop-up clinics. Again, thousands of doses were targeted to these communities that I'm responsible for because of these partnerships that were created. And I can't thank them enough. Pavia Unvala was the contact over at Walmart, and again, she had all her resources brought to bear. Some of these clinics, she had 20 people show up, 5 or 6 pharmacists giving shots. We were able to move 500 to 600 people through these clinics, which worked out very well. We had 2 or 3 of them right at Our Lady of Good Counsel at the school building, and so that worked out very well. And we've had some other locations as well. And so those partnerships were really important to our operation. I think we've hit on something with these public-private partnerships beyond the pandemic. It's something I believe in. I think that we should keep these relationships going, and they could bring other services to our communities. And I have to tell you, all these efforts, vaccination efforts, contact tracing, was done with very little tax dollars. These partnerships with Atlantic Health and Walmart especially, there were virtually no additional tax dollars used for these vaccination efforts. So I'm proud of that. I think the staff was very receptive to it. They were excited to partner up with the private sector. We made a lot of friends in the private sector, and there may even be some social opportunities that came of it. but it's really a wonderful thing, and I'm grateful to them for all they did. Anyway, that's basically the highlights of the pandemic. There's been, again, so much more over the 18 months, but that gives you just a basic overview. And so I'm prepared to take any questions on these reports that I submitted on the routine stuff, but anything on the pandemic I'd be happy to answer.
I've got a quick question.
Yes.
First, thank you. I really do appreciate everything that you've done over the last 18 months and beyond. I know you were kind of thrown in chaos. You start this job and the end of the world comes, but you did great, and I appreciate everybody downstairs, all of you guys together.
Thank you.
I do have just a question under vital statistics. So when we talk about, let's say, deaths, you have resident and non-resident. Is that all of the deaths in each township? Like every person that has passed, let's say, in Kinnelon or Pequannock?
Yeah, well, the vital statistics, yes, these totals are for all the communities.
So that's everybody that passed in 2020.
Under deaths, right, for under 2020. That's the totality of the deaths.
So non-resident is they died in Pequannock, but they didn't live here?
No, the resident, that's the hospital, and they're not residents.
Gotcha. And then I see how you have it split down, but I don't see a place for COVID. So is the COVID numbers included in this, or no?
No. These are deaths for all reasons, because the COVID numbers, the COVID deaths are really determined through, not through the health department, it's through the Office of Vital Statistics at the state, and through medical examiners and the hospitals. And those are not records we actually warehouse, like specifically for COVID, because it's something that we don't have a system to actually go into the computer and pull out reports on COVID deaths.
So-
And usually, they could be secondary COVID death.
Right, right.
There could be other underlying reasons for the death, and it's very hard for us locally here to parse
To figure that out, right. But at the end of the day, in Pequannock, this is every person that passed in 2020.
For all,
Across the board.
Across the
And
board.
if it was COVID or it wasn't in any one of these other buckets, it would have gone into all others.
yes.
Okay. Thanks. That's my question. I appreciate it.
What about opioid overdoses?
Opioids are not, they're not specified in the
They're not either.
in the categorized thing, but.
So they would go into
But there are other resources that can be utilized to try to determine opioids. There's things at the state health department that they might provide tools and resources to do some research on opioid deaths.
Right.
But just like the national average locally, it's gone up. It's been up.
Yeah.
And it's
Yeah.
been troubling.
I'd like to see us start to focus and do a lot more brainstorm, do some.
Yes, I agree. I think there's been several, we've had such tunnel vision on COVID.
Right, that's what I'm saying.
And we've tried to balance it as best we could, but it sucks all the oxygen out of the room.
Right.
And, but we are anxious. As a matter of fact, all our policies are based on trying to get kids back in school, trying to get sports activities, trying to get all these things, so the depression rates and the propensity to start looking at opioids as a relief
Right.
becomes less, when you have these alternate
Right.
things. So that's one way we were addressing it. And unless it was strictly prohibited, we always advocated to get people back. We even talked to the hospitals, the nursing homes about visitation. Can they get people outside to see a family member? We tried to work with that. Staff shortages made it almost impossible for them to do anything. But yes, I think that is something we have to get creative about. Opioids is a serious problem, and they do have to be addressed more aggressively.
I think you did a great job, thank you.
Yeah.
Yeah, you really did. Thank you so much.
Unfortunately, you rolled right into the new job and boom.
You got it.
Yeah.
One way to
It was that
start.
same day. Yeah, it was March 9th.
Oh
was
my
the
gosh.
Emergency, and that was my first day. Yep.
And we were gonna have Pete stay on for a couple weeks to work with you,
Yeah,
but
yeah, he's...
we thought it would be best just to send Pete home and.
Yeah, well, yeah,
rather,
and the problem was he couldn't really train me in any of the routine stuff.
Right.
And he didn't know anything more about a novel strain that I did. I mean, nobody knew anything about it. So it wasn't useful for him to put himself at risk here.
Yeah.
After his 45 years of dedicated service, I
Absolutely.
think it was time.
Yeah, what a way. That's
crazy.
I do want to say one last thing. Well, first with Pete, I mean, he did leave an infrastructure there that I had something to work with. When I came in, that staff was trained, they were in place, and so accolades to Pete for what he had built here over those years. So I just want to mention that. I also want to mention that in the guidance and giving guidance to businesses and everything else, here in Pequannock, Town Hall was open very early in the pandemic.
I don't think we ever closed.
No, but I just want to say that there was a high level of service from early on, and if you compare it to most other communities, if not all, we were ahead of the curve on
yeah.
that. But the reason I mention that is because I very appreciate Adam, that he worked with me in collaboration to formulate policies that kept the public safe, kept the employees safe. It was not willy-nilly, it was
Right.
well planned out.
Kept us open, yeah.
Yeah, and so I just want to thank him for consulting me. That was his decision to bring me in and to discuss these things, and I appreciate that.
That's awesome.
Yeah, great job.
Anything else?
Thank you.
That is all.
Thank you.
Next on the agenda is public comment. If anyone wishes to address the council, please wait to be recognized to come to the microphone and provide your name and address for the record.
This is for the health meeting, correct?
Correct, for the health meeting. There being no further business, is there a motion to adjourn?
I'll make that motion.
Is there a second?
I'll second.
All in favor?
Aye.
Meeting adjourned at 6:55.